So I'm really, really excited to see you. And W, as I call you, you are one of the women that, first of all, you're one of my most recent, really, really close friends, right? I mean, we know each other, since 2001? So we are actually, we
2003
know
or
each
so,
other.
for a long time. Yeah,
It's
since around that.
actually quite, yeah.
I
a
actually
long
just found the
time.
pictures of us from our first hike.
Oh, really?
I have all
I remember that. I have that too. But anyway, so I have seen you grow from a young woman, always intelligent and always, aware and always funny and all of that, into this extraordinary, accomplished many things.
Mm-hmm.
First, you are an accomplished mother, and you've embraced your role of motherhood with so much passion and interest and devotion, but at the same time, you just enjoy them so much and you never patronize. I mean, it's quite amazing. I know your 3 children and they're just wonderful. And you have created yourself. I mean, you were married when I knew you, and you're not married anymore. And you have created a world and a home and a life for yourself, personally and privately, that is beautiful and admirable. And then you created a company, the 23andMe, that has become not a word, it has become, it's like refrigerator, frigidaire. I mean, oh yes, you should 23andMe I mean, it's become a verb. It's become a part of what you could do for yourself. So talk to me about how it happened, 23andMe, and just talk to me how you started and what was your dream.
I always, I feel like I'm really lucky because my parents always encouraged me to follow my passions. And so
yes,
I never
we have
followed
to say that you're one of 3 sisters, and you're all incredibly successful in every facet of your life.
So right, my parents, I have two sisters, and my parents raised all of us to be quite independent, and to, that all of us would have passions one day and that we should follow those passions. And one of the best things my parents also did was they taught us to be financially independent. And the main thing my mom taught me was that, you're going to have a budget, you have a certain amount of money. How can you save money? And how can you actually know there's all kinds of temptation out there, but learning how to save. And by having that financial freedom, you're actually really free in your life. Like I could, I could live in New York, I could make all kinds of choices, and I made career choices that I wanted. So I worked on Wall Street, not because I was, so focused on trying to make money, but I was so interested in healthcare. And there was nothing greater than learning about healthcare through the lens of, the financial engine. And Wall Street. So I worked on Wall Street for 10 years. But during that time period, I came to realize that the voice of the individual really did not exist, and that healthcare is largely a world where it's between business to business.
What did you do in the financial world?
I was investing. So I worked for a number of different funds, and I had money allocated for biotech investments, and we chose investments in various biotech companies. So we did, and again, I focused on biotech, but I did everything really from birth to death. And we used to do everything from, hospitals to hospice care to neonatal work. So I did everything. And I just started to realize that healthcare was really not about you and what's in your best interest in keeping you healthy, but it was a B2B business. And because you only make money when someone's sick and you're actually in the system, your incentives are not aligned. So my middle sister, Janet, who studies obesity and is epidemiologist, she would give this talk about obesity and the crisis and how awful it is in the world and all the issues that come with obesity. And then I would give a talk that says obesity, the ultimate money-making opportunity. Like,
Oh my
obesity,
God.
and it was like obesity. It's not just, you look at it, you can look at it two ways, either
So
as,
you can look at it as a marketing option.
well, I looked at it as like people who are obese have higher rates of heart disease, diabetes, diabetic retinopathy, foot ulcers, like everything. You name it. It's everything. And it's not an acute illness that goes away like an infection. This could be 20 years, like 20 years of heart disease, of diabetes. And so if I successfully get you to never be diabetic, you're not going to spend any money. But if you become diabetic, then you're going to be in the system.
Oh
And
my
the
God, that
hospitals-
is terrifying. This is so interesting.
Well, it's part of what I realize is that the incentives are just not aligned, that the healthcare system is a system full of all these really good people who genuinely care, but the ship is just pointed in the wrong direction.
Oh
And
my
fundamentally,
God.
no one makes money off keeping you healthy. Like if you successfully live to be, healthy at 100 and you have no chronic ailments, you're not part of this GDP equation of healthcare. Like you're not making money at a hospital. No drug companies are making money on you, like nothing. So I started to realize that incentives are just not aligned. And I also knew enough after working in the industry that you're not going to change it from within. There's no way. There's so much. There's $3 trillion. It's the largest industry. You're never going to change healthcare from within. That the way you're going to change it is you have to have a crowdsource uprising. So part of what inspired me is what I saw happen with HIV. Like it was the patient advocates who came together and who said, like, we're not going to take this anymore. And they stormed the FDA and they protested to pharma companies and they lobbied, they came together and they put together like their own research plan. They got super involved, they got educated, they were activists. And my idea was, how do I actually wake up the entire world and say, if you want to be healthier, you actually have to be your own advocate. You have to start to advocate for yourself.
I love this. I've never heard you say this. This is brilliant. Oh, this is great. Okay, go on.
And that's where, again, 23andMe really came from this idea that if you want to change healthcare, you have to wake up people and let them know that they're actually in charge of themselves, and that by crowdsourcing, everyone coming together, we all have a common interest of being healthier. And so all of us, we can create a competitive environment to the entire existing healthcare system. So the existing healthcare system can work on if you actually do get sick, but you have to have an almost equal but separate world that thinks about how do you keep people healthy. And so 23andMe came with this idea that the best way for you to stay healthy is first to know what are you actually at risk for. So we all have a different set of risks in our background. You can learn that from family history, but it's much better to look at that from your genetics. And if you know that you're genetically high risk for atrial fibrillation or type 2 diabetes or breast cancer, then you can take proactive steps there. And 23andMe, by bringing together, let's say, everyone, 23andMe, for instance, has over 1 million people in our community who are genetically high risk for Alzheimer's. So can that community come together and say, let's start to think about what are the things that we can do that actually could prevent Alzheimer's, rather than just waiting for a treatment? Are there things that we can do by knowing that we're genetically high risk? Can you change your behavior? Can you change your exercise? Like, what is it that you can do that actually is going to have an impact? And we see this now in 23andMe.
Let me ask you a question. Is the medical, how do you call it? Are they threatened by that? I mean, it is true that I never understood that hospitals or diseases have marketing department, right? I mean, it always like, what do you mean? But the way you explain it, I get it. But
Well,
does
it's the type of thing, like one of my friends, she runs a diabetes prevention group, but she's always reminded by the hospital she works at that she is a cost center. She doesn't generate money, because what
oh
generates
my
money for
God.
people is when you
It's
actually
like you're
have
sick.
diabetes, you come in. You know, the reality is if prevention paid, the government would pay for everybody to have Weight Watchers or a diet program and a free trainer. Like everyone knows that exercise and what you eat
So
matter, but it's not part, like your doctor's never going to go and say like, hey, like here's a trainer for you, even though that is what people need.
oh my God, but this is revolutionary. So how do you change that?
Well, what I have found is that people
No,
in
but
some way,
before, yeah, okay, never
yeah,
mind,
go
go
on.
on. Yeah.
No, I think that what I have seen is that people actually want to be healthy. They just don't know how. And if you go to the doctor and they tell you you're high risk for diabetes, you're overweight, your blood numbers look bad, and then they send you home. Like,
Oh, with medicine.
kind of like you're kind of thrown into a complicated situation with no guidance. So there are a number of startups I have found that are trying to help people. Like I find that people genuinely care, but they need some kind of guidance outside of the healthcare system. Like the majority of your life is lived outside of the healthcare system. You only go to the doctor a tiny amount. So you need an infrastructure that helps to support that. And that's part of what we're trying to do. And when we think about partnerships, and what I'm excited about with digital health is companies that help think about like daily management programs, like my Fitbit every day reminds me, how much did I sleep? How much did I walk? So if you know, for instance, that you're high risk for something, you know, keeping track of when you're going to bed or when you are exercising is actually really important for you and can help prevent it.
This is really interesting. But so it's not just about knowing that you're a little bit Indian and a little bit Italian and a little bit all of that, right? When you go into 23andMe, what you learn is you have. Yeah.
I think what happens,
Hello?
the ancestry side is, in some ways we look at healthcare tends to just look at you as like you walk into your dermatologist and they only care about your skin. Or if you have,
That's right.
If you have a heart problem, they care about your heart. And 23andMe, when we started the company, we were really absolute. I don't want to just be a health company and I don't want to just be an ancestry company. I want to look at you in totality, that like you are a whole person and parts of who you are is your health side, but then you have your identity of like, who are you today? And then your ancestry, who is it that, you know, where did you come from? So it was important for us to have that holistic approach, to look at all aspects of people.
All right, so you did that, and it's absolutely fascinating for the individual. But what I think you are also doing now, which is so interesting, is you're doing partnership with drug companies, right?
Mm-hmm. Well, what we're using now is we said again, I kind of look at two aspects of 23andMe. We have the prevention side, and then we have a drug discovery side. And one of our taglines is change what you can, manage what you can't. And that specifically goes with, if there's things that you can change in your environment that are going to make you healthier, we want to be the partner that is going to help support you and help you get there. But if you have some things that you can't prevent always getting cancer or having heart problems, etc. So we'll help you then manage that. And is there a way, can 23andMe, by looking at genetics, can we actually better understand, you know, how to develop a drug and actually have more effective therapies? So we have a big partnership with GlaxoSmithKline, and we're looking at all 12 million of the customers who have opted into research, we're looking to see, can we understand the genetics of disease? And then can we develop better therapies for our customers and for the whole world, so that when you do have a problem, if you have a problem, we can be there to support it in some way.
That is great. So what is the relationship that an individual should have with 23andMe, just from the beginning?
Well, individuals decide. They decide they want to, they can either have ancestry only, or they can have ancestry and health. And then we give them a choice. Do you want to participate in research or not participate in research? And 80% of our customers decide to participate in research. So we don't default you in, we don't make a choice for you. It's really important for us that you actually start to take this ownership over your genetics and your health and your whole life. Like, to me, it goes so much with ownerships over your own, like taking control of how you're living your life.
Okay, so let's just say that I am your customer and I decide that to go for research. What happened? Do I hear back from you?
Yeah, so you consent, you click on a box. You click on a box that say, I want to consent for research. And then we ask you, we have a number of research questions. So we'll ask you a comprehensive set of questions about your health history, your background. And then, for instance, let's say you tell us that you have a family history of Parkinson's and you like coffee. Maybe we'll send a coffee survey to you, or a Parkinson's related survey. And what's important for people to remember is that we need to know people who have a certain disease and a condition, but it's equally important to know people who do not have it. So for instance, in Parkinson's, I have 30,000 customers who said that they've had it, but I have, 800,000 who've taken the survey who said they haven't. So I need cases of the people who have the disease, but I also need controls of people who do not have it. So what we do then is we do research. And with all of our research, we make sure that we're publishing in an open access journal and that our customers can always read the results. So we have, if you look on the 23andMe website, we tell our customers, here's all the publications. And then we actually give our customers a number that says, your information has been used because you contributed. You were part of these 40 publications. So you made these publications happen. So we want to specifically empower our customers to know, I'm moving this research forward.
That's great. That's great. You see, a lot of people don't know that. So in other words, the more data you have, the more valuable this becomes, right?
Correct. We want to be able to understand every disease out there. And when we had one paper that I loved on depression. And depression was important because it affects so many people. People had never seen that there was any kind of genetic associations with it. But what we found, we had 450,000 customers who participated in this survey. So we used data from 450,000 customers, and we found a number of novel genetic associations with depression. So that's important because we had so many customers who wrote in who were really passionate, who said, I know people who've been depressed their whole life, like finding anything about it that, in their DNA or some kind of reason potentially why they have this is so important and meaningful to them. So it's really like we find people who have the condition, it's important, and people who do not have the condition, but they have family members or friends who have it also really want to have that.
So, okay. So you started this company in 2006, so it's 14 years ago. Where first of all, in your wildest dream, did you imagine you would be here where you are in 2020?
I think one thing as starting as a founder, I think you have to always only imagine it succeeds.
No, so I know.
In my mind,
the impact.
I I think I always imagine, I mean, for me, because so much of what we did, again, if I look at my history, I wanted a movement like the HIV movement. So in some ways, I feel like I'm still just scratching the surface of the potential.
Yeah, no, I know. But you see, you've never told me that this way. I mean, I'm so interested. It's so interesting. So we have to actually rally. We should all rally in order for more people to subscribe in 23andMe,
Yeah,
for more people to know, because the more you know, the more you help humanity, right?
correct.
I mean,
Correct.
and
And I
so,
think one thing that we did that was really important in the beginning of the company is we let people have their raw genetic data, meaning like you can download your genetic information. And then if Stanford is doing a study or Harvard is doing the study or Pfizer is doing a study, you can give your genetic information to any other study that's out there. So we really wanted to empower you to be the owner of all your information. Instead of, I think people don't realize that if you participate in a study at Stanford, they own your information and they're not going to share it with anyone. And that to me seemed antithetical to what's in your best interest. If you have Parkinson's disease and you participate in a study at Stanford and then they won't share it with people at Harvard or Hopkins or Pfizer, like because they want to own that discovery, that's not in your best interest. That's not what's going to find you a treatment as fast.
okay, so would you call yourself the grassroots, truly democratic movement of giving the individual the power of healthcare in a big way? In other words, you explained so well when you talk about the HIV that it's the advocacy that made it happen. So is it right for me to say that what you have created with 23andMe is a grassroots movement for the individual to rally together so that they can have a voice that's useful as opposed from the scientists to deal with the disease? I mean, it's such an interesting way. It's the voice of the people.
Yes. So when we started the company, a lot of it, like when I see what Susan G. Komen did, it's amazing. You got millions and millions of people walking, raising money. But at the end of the day, they raise money, they send the check over, but do any of them know what's happened with the money? Like I found no, like people don't follow through. And what I said is the most important thing you actually have is not your money, but your data. Because the way we're going to solve healthcare problems is by all of us coming together. Humanity fundamentally has to come together in order to solve it. So what I really tried to do was marry the concept of Susan G. Komen with a Facebook social networking style that's all based on your genetics. And we're going to use, again, allow people who are interested in this come together, and we're going to try to solve disease and health. I think that's where, again, it's almost like, one thing, again, obviously, because Susan, my sister, runs YouTube, I think about this as the way media changed is in some ways because you had a platform like YouTube, which was powered by the people. The only thing that was going to drive that change in cable and in entertainment was that it created a competitive world.
That's right. So basically what you are doing with 23andMe is you give the individual the information about their bio whatever, right? You give them all the information about themselves. And by collecting the data, you are giving information to improve the world. Because one of the things that people get confused about is, I don't want to give my data. And what I think is important is that you say, don't you understand that by giving your data, you have power to turn around the healthcare system by by creating the voice of the people and the voice of the needs. Is that making any sense?
Absolutely.
This is great. I didn't know all of that.
Yeah,
I really didn't.
think, you know, one of the things that's also important is that we let people decide if they want to do it, but you can absolutely do 23andMe and not do research. Like one of the things, like you have the ability
I know,
to opt in
but what
and to
I
opt
think,
out.
yeah,
I think
what
what
I think is
that's been
interesting.
so important though is that so much of research in healthcare, like if you know the Henrietta Lacks story and these stories that happened, the Henrietta Lacks story was a story about an African-American woman, I think it was in the 50s, who had ovarian cancer, and they took her cells without asking, and they formed these cells called HeLa cells, and it's now everyone in the research world uses HeLa cells. So essentially they took a piece from this woman, frankly, when she was dying, and they never consented her. And now the entire research world uses her cells. So one of my favorite quotes from the book was, I would have loved to participate in research. I just wanted to know. And I think what's so important, you're so rarely asked your opinion in healthcare. And frankly, that's because it's not a B2C business. It's a business to business relationship. You don't actually really matter. So it's important for me to emphasize that point. Part of what we're trying to do is give people back the sense of power, and also to teach them, you should ask. Like when you go to your doctor, like when I go to Stanford, I have a consent form and I have to sign something, but it doesn't give me the ability to opt out. Like try going to your doctor the next time you go and say, I do not want to participate. Like, I do not want to sign this. Like they don't know even what to do. So that's part of it's part of the uprising. You got to teach people to ask questions and and own their health.
Okay. So this has been truly, truly interesting. Really, truly interesting, because it shows people that, I mean, what you explained today is that what you want to do with 23andMe is you want to be able to use the voice of the people in order to change humanity. So, okay.
Absolutely. We see ourselves today, like we are the people's pharmaceutical company. Like we are powered by our customers, and we will when we have therapies on the market, we have to find a different way, a different promise back to our customers, because everything that we're doing comes from our customers.
Is that what you want to do?
We will have therapies. We will have therapies at some point, and we will absolutely have a different set of commitments. Because think about, drug industry is so interesting to me, because they fundamentally, like when you have an illness, if you have like hepatitis C, it's cured. So what other industry do you have a product where you cure someone of something awful, but then you hate the companies? Like people hate pharma companies. They hate insurance companies and pharma companies. And part of that is because I don't think that they have the appropriate relationship back with the consumer. So that's where I see a huge opportunity for us as like the people's pharma company. We want to save people. We want to absolutely have therapies that are in the best interest of our customers.
Right. Great. So now we are at the end of our interview. What is what you want everybody to remember, and how can we participate to your movement?
Well, the most important thing that I think about in healthcare is for people to remember that they're actually in charge of their health. Like what I love, like when I wear my in charge necklace,
we both have it.
I know I'm not wearing it right now, but I have it. But I need, every time I go to the doctor, I like to wear that and remember, because you're so used to being bullied around, like you're actually in charge. And the most important thing, like 23andMe is about you taking ownership of who you are.
I love it.
Your identity.
I love it. I love it.
But that's why I love the in charge movement so much, because again, it's everything about, like, healthcare is the last frontier where you're not treated like an adult. Like you don't have the ability, like the system assumes that you are incapable of going out and getting your own prescriptions. Like you might take medications without the appropriate oversight, or you can't even draw blood in the appropriate way. Like it's a very paternalistic system. And that's fundamentally what we're trying to change.
So in your enormous war, or in the enormity of your goal, from 1 to 100, where are you today?
Oh, I think my personality type is to rarely sit back and say, oh, this has been great. Like
I say, but are you at 20?
No, I think we're at like a 10, 15. We're just starting. We're just starting. Like what's so exciting that's happened lately is by having over 10 million customers, I have critical mass. Like people no longer can, like I'm like at the beginning of the revolution. Like 10 million is no joke. So like it's just beginning. And that's where like more and more is coming. But again, it's as people, I love it when people like realize like it's so empowering to get something as fundamental as your DNA, like all on your own. You get it without a physician. You can just buy it online. It's affordable. All those things that my mom taught me are so empowering.
I love this. This has been great. This has been so enlightening to me. But before we stop, we cannot, because this is 2020. This is the spring of 2020. So we absolutely must talk about the coronavirus. So make it short. What do we do? Where is it? What we got to do?
Well, 23andMe is doing an interesting study on the genetics of coronavirus and why do some people get so sick and why do some people not get sick? Because it looks like there's clearly a genetic foundation that says whether or not people are going to be severe and need to be hospitalized and people who have mild symptoms. So 23andMe is giving away free kits to anybody who has been hospitalized with COVID-19 because we want to do that research. So we already have 600,000 of our customers already participated in that survey. So that sort of shows the power of our platform. I have, 10 million customers in research, like 600,000 of them already took a survey about it. I have over 8,000 customers who said they have had COVID-19. So we have a lot of people we can analyze, but we need to get more people who were severely hospitalized. And my hope is that end of this year, you potentially could have a genetic knowledge about why some people get so sick and some people don't. And the people who are genetically higher risk, you can protect them more.
I love it, Anne. I mean, this has been amazing. I mean, nothing that you have said I knew, or very little. And you are really you are an exceptional woman, and you have an exceptional goal. And what you taught all of us today is that it's not just about finding out who you are, but it's also using this to create a movement, to be more involved with what happens to us.
Absolutely.
Thank you so much. I love you. God bless you.
I love you. I love the In Charge. It's like it's the best movement ever. And it's all thanks to you.
I love you.
I love you.
Bye.